Good evening, students. Welcome back to geometry. See, projection geometry is something in which we learn about the principles. Whenever we want to take an image, there are certain principles or rules which are followed so that we can achieve or we will be able to produce an ideal radiograph. Okay, so taking into consideration the clinical scenario and the area of interest and everything, there are certain fixed principles which are followed. Okay, so let us go to projection geometry. So projection geometry is the structures being radiographed and the position of the X-ray beam. In order to achieve the optimal radiograph, the following principles need to be considered. Okay, first let us list out what are the principles. There are 6 principles. There are 6 principles. So what are those? The first one is representation so that you understand better. Okay, so the focal spot should be as small as, example, if this is an X-ray film and this is the subject, okay, and the source which is coming, and then this is the focal spot. So what exactly it is saying? The inverse square law, if you remember. Okay, so the focal spot should be as small as possible. Okay, so that this penumbra is reduced. Do you understand what is a penumbra? And umbra is something in which the part of the radiograph or the part of the final X-ray where your area of interest, for example, a tooth, is seen. What is a penumbra? Penumbra is something which is like, not of a diagnostic value. The other area here, it is represented as a black slab, and then that is the detector, and you can see penumbra here, and this part inside that white or the light gray part is the image. Okay, that is because the source or the focal spot is here, the object is here, sorry, the subject, and then this is the detector. In the second diagram, if you can see, the focal spot is smaller or it is placed away, little away from the subject. That time what happens, the size of the penumbra is naturally reduced. Okay, there will be more image. And in the last one, when there is a good amount of distance or the focal spot is really small and placed at a distance from the subject, then your drawing should as small as possible. Coming to the second one, the focal spot or tooth distance should be large. See, a tooth, and this is a source or the target. Okay, what the tooth and the target should have a larger distance in this. Here they have shown 2 things. That is over here as well as it placed over here. If you can actually see the first tooth over here, this is where X-ray is coming, okay, and this is the Okay, so the X-ray beam should be perpendicular to the tooth. In this diagram itself, okay, this is the film and this is the object, the tooth. Okay, these are parallel to each this like this and this is coming and falling in this direction. So it forms a right means what the X-ray beam should always be perpendicular to the long axis of the tooth and the X-ray film. Okay, rule. The last rule, tooth should be positioned center of the film. What's the rest area of which is what in purpleize. So what happens is when center of the film. So this is the last. Okay, about techniques we will be learning in detail in the following chapters also. But for this, for the purpose of understanding geometry, really, there are two techniques which we take for a intraocular radiograph. Okay, is very commonly done in routine clinical setup and even for a dental checkup as well as treatment procedures. What are the two techniques we follow for intraoral periapical radiographs? The parallel right angle or long cone technique. Okay, it is an oral radiographic technique. Placement. Okay, how? See this one. This is a film holder in which the sharpness, that we have to see depend on what factors the sharpness depends on, how the sharpness and the unsharp image, why it occurs. Okay, so the sharpness of an image is dependent on the penumbra. Coming to this diagram, what it says, decrease in focal spot size is an increase in sharpness. If you can see over here, okay, there is a this black color is representing your X-ray film. For example, this striated lines over here, these lines, this round is representing the tooth, and this is the target. Okay, so this is a small focal spot. Okay, and what is this black color? In a film, wherever the image is produced, the diagnostically valuable image is produced, that is called as the umbra, which is represented by a black round over here. The one which you can see, the whitish round away from the umbra, is the penumbra, where no diagnostically valuable image is produced, or the sharpness in this case. Okay, so here focal spot size is decreased because it is placed away, right? So there is an increase in the sharpness of the image. Whereas on your right side, if you can see, there is not much of a, there is an increase in the focal spot size here. Okay, so because of which what happens, the penumbra is more. So there is image clarity will not be satisfactory, or there will be a decrease in the sharpness of the image. Okay, so smaller the focal spot, increasing the sharpness. Second, increase in source tooth distance is equal to increased sharpness. Okay, so here this is a film, the black one, this is the tooth, but we are placing the target very much far from the umbra. So any penumbra is formed, only the umbra is there. So an increased sharp, a very good sharp image will be formed. Whereas the one on the right, if you can see, here we have brought down the distance between the source to the tooth. Now what happens here? The penumbra is formed. So there is a decreased sharpness in the second image. Okay. Third one, decrease in tooth film distance, increase sharpness. Okay. These are the film. What it is showing, we have set the target or the spot. If coming to this diagram, over here where my cursor is moving, here there is a decrease in the tooth and film distance. So here the penumbra is less, so the image will be definitely sharp. Whereas if the instead of decreasing the tooth film distance, if you have sharpness, because there is a penumbra formation over here comparatively, you can see. Okay, then fourth one is movement of the tube, patient, or film, that causes decreased sharpness. As you can see on the right side of the image, there is no sharpness in this X-ray at all. Okay, so these are the four factors on which sharpness of an image is dependent. Okay, now coming to magnification. What is a magnification? It is an increase in the size of an object. In radiography, it is caused by divergence of the X-ray beam as it moves away from the target where the X-rays are produced. So there is a magnification of the image. Okay, fine, sir. Fine. Thank you. Yes, yeah, sure. Okay, thank you. Yeah. Sorry, some technical issues. Is when the target beam is more away from the X-ray film, then what happens is there are more diverging rays, okay, and they cause a more magnified image, as you can see here. Okay, so this is what diverging rays from, that is a peripheral thing. Okay, so when parallel rays are striking, there is less magnification of the image. Then object film distance, decrease in the film to object distance. There is less magnification. Okay, decrease in the film to object distance. Now if you can see over here, there is a film, and this is the object, okay, and the target is the same, and you are shooting a beam of X-ray. What has happened? There is a not much magnification which has come in the image, okay, whereas if that there will be a magnified image over here. Okay, so this is what causes the magnification, and how to control this error is by following these things, these principles. Now, image shape distortion. This is also very important, because whenever we are imaging an area, it may be to check the normal anatomy or a pathological condition, then the image should be almost as good as the normal place which we want to achieve. Okay, that is a optimal radiograph. What happens in image distortion? There may be many chances of misdiagnosis and misinterpretation. So it is the result of unequal magnification of different parts of the same object. Here, it takes place when all the parts of an object are not at the same focal spot to object distance. So, to avoid this distortion, what we must do? Position of the film parallel to the long axis of the object. Same thing. So this is a film, and there is long axis of the tooth is also parallel. And then where will be the central beam of the X-ray? It will come perpendicular to it. Okay, so position the film parallel to the long axis of the object. Next, orient the central ray perpendicular to the object and film. Over here, if you see, this is the film and this is the object, okay, what you want to image. And these arrow marks are showing your X-rays, so these are perpendicular. So if vertical angulation, I had shown you a table, right, the different degrees of different tool. So if vertical angulation is increased, there is a shortening of the image. It is a radiographic fault. I had taken this in the previous class. What happens if the image looks shorter than it actually is? Okay, so if horizontal angulation is increased, mesially or distally, that is the position of the cone, there will be overlapping of the structures. Okay, that also happens in this image distortion. Now, so basically, dental surgeons use the principle of projection geometry to maximize the image clarity, minimize the distortion, and localize the objects in the image field. I hope you have understood what exactly is projection geometry, because these are the principles which is put into use for taking any radiograph, be it intraoral, periapical, bite wings, occlusal, and the various extraoral projections. Okay, so let us discuss the MCQs one by one for this particular topic. Coming to MCQs, The first question, the capability to radiographically produce distinct outlines of an object is called as option A, that is sharpness. Second question, methods for minimizing the loss of image clarity include all except one. Which one is the exception? Option is minimize distance between object and film. Yes. Use as small as effective focal spot as practical. Yes. Increase distance between focal spot and object being radiographed. Yes. But option D, minimize the focal spot to film distance, maximize object to film distance. No. Okay, they don't improve any clarity of the image. So question number 2, answer is D. Question number 3, which factor determines the size of the focal spot needed? Okay, the option is C, effective heat dissipation of the machine. Then question number 4, which phenomenon is responsible for enlargement of the radiographic image? The option is B, that is divergent paths of the photons. The ray is divergent, right? So that is responsible for the enlargement or the magnification. Okay, so fourth one, answer is B. Fifth one, which cylinder best minimizes image magnification? The option is A, that is long cone technique. Okay, that is paralleling technique. So sixth question, to minimize distortion, which is the ideal position of the image receptor in relationship to the object? Option is C, parallel to the long axis of the object. Question number 7. If the object is not parallel to the film but the X-ray beam is perpendicular to the film, which phenomenon occurs? Option is D, that is foreshortening. Okay, that is increase in vertical angulation. So seventh one, option is D. Eighth question, excessive vertical angulation is most evident on which teeth? That is C. Maxillary molars, angulation, excessive vertical angulation. It gives a image as if the tooth is very long than its actual size. So eighth one, answer is C. Ninth, which method of dental radiography utilizes the placement of the film as close to the teeth as possible? Option is D, which is that bisecting angle technique. Okay. So tenth question, which decreases image distortion when utilizing the bisecting angle technique. Option is D. Direct the central ray perpendicular to an imaginary plane that bisects the angle between the teeth and the film. So 11th question, if the central ray is directed at an angle that is inclined with more negative angulation to the bisector, the resulting image is B, that is elongated. Elongation of the image is seen. 12th question, to achieve tooth to receptor parallelism, which is the usual location of the receptor? That is C. Um, in the middle of the oral cavity, away from the teeth, ideally. Okay, then 13th question, which condition compensates for the magnification produced by placing the film in the middle of the oral cavity away from the teeth? The option is B, use of long open-ended aiming cylinder. Okay. Coming to 14th question, the right angle technique for object localization is best for areas of interest within the, okay, the option will be B, that is mandible. Right angle technique, that is the paralleling technique. That is because of obvious reasons, because of placement within the sulcus and the other things. So 14th option is B. 15th question, compared to photons traveling at right angles to a surface, photons traveling through the periphery of a curved surface are, option is C, less intense. Okay. So 16th question, which structure does not demonstrate an eggshell effect when radiographed? That is A, that is tongue. Okay. So 17th question, which is the reason that the periphery of an expansile lesion appears more radiopaque than the interior? Why so? That is an eggshell effect. Okay, we will learn all this in the projection and when we go chapter wise about different diseases and radiographic interpretations, we shall learn in detail about what is an eggshell effect. Okay. So coming to 18th question, if a dentist has two radiographs of a region of the dentition that were made at different angles, which would be the point of reference for identifying changes in horizontal or vertical angulation? Answer is D. That is relative position of osseous landmarks with respect to the teeth. So this is the next chapter wherein we will be learning normal anatomical landmarks, which is very important. Okay. So coming to 19th question, if the tube is shifted to a more mesial angulation to the reference object and the object in question also moves mesially, then the object in question is located, that is C, lingual to the reference object. Okay, this is called a slob technique. Okay, same side lingual, opposite buccal, that means. So this is our the chapter after the next chapter wherein we will learn everything in detail about intraoral radiographic techniques and positions. Okay, so 19th answer is C. 20th, which is an imaginary line that divides the tooth longitudinally into two equal halves. The answer is B. This is a long axis of the tooth in the center of the tooth. Okay. Coming to next question. The middle portion of the primary X-ray beam is called as, that is C, central ray. 22nd question. If the angle formed by the film and the object is bisected, then which is the relationship of the bisector to the aiming cylinder? Answer is A, parallel. Okay. If the angle formed by the film and object is bisected, then which is the relationship of the central ray to the bisector? Over here, the answer, 23rd, the answer is D, that is perpendicular. Okay. 24th question. Which components form the angle referred to as the bisecting angle technique? What are the things? The tooth and the film, basically. So option is A. There is an angle formed between the tooth and the film. Imaginary bisector is drawn and the X-ray is aimed at the center of that. Okay. So 24th option is A. 25th question. When positioning the aiming cylinder, which plane does not differ between the paralleling technique and the bisecting angle technique? Option is B. Horizontal plane is not different in both. They are the same. So 26th. Disadvantage of incorrect vertical angulation include all except definitely, because those radiographs repeated and necessitates the repeat of patient exposure, which is unnecessary X-ray exposure. So the first one is not applicable here. So 26th option is A. 27th question, which is the result of correct vertical angulation? The answer will be D. Image of the same size as the object is found. Okay. So, 28th question. Which image change occurs when an 8-inch aiming cylinder is used? That is C. Increased size distortion is a possibility. Okay. Coming to 29th question. In the paralleling technique, the central ray is at, they are at 90 degrees to the receptor and the long axis of the tooth. So 29th option is C. Okay, so this completes our important chapter on projection geometry. Please read through again and go through the MCQs, and please approach me in case of any doubts. Okay, thank you so much. Our next topic will be intraoral radiographic anatomy, or otherwise called as normal anatomical landmarks, which is very important to study further into radiology. Only when you know the normal, you will be able to tell which is the pathology. Okay, so thank you so much, and keep studying.
Yes, ma'am.
Yeah, it's done.
Okay, that's good. Actually, I was having my dinner
Oh,
sideline,
is it?
so I didn't notice.
Oh, okay.
Yeah.
And sir, please stream one more lecture of mine tomorrow at the same time. It's almost ready. So I just need to make little amendments to that. So tomorrow